Thank you for joining us this afternoon for assembling your brain health team. We would like to note that the information in this presentation is for educational purposes only and does not constitute medical advice. Our information is intended to empower individuals, their families, and healthcare professionals who want to collaborate in the most effective ways on this journey to health and well-being. Please see a licensed and qualified medical professional for your medical needs. I'd like to welcome our moderator, Steve Ledvina, who is going to give us a Stay Sharp program update before kicking off our presentation. If you do have any questions during the presentation, please type them in the chat box, and we will answer them during the Q&A at the end of the presentation. Thank you, Steve, for joining us.
Thank you, Joan, for the introduction. I guess I'll introduce myself and we'll introduce Nancy and Lisa right at the beginning of the main event. So I'm Sharp Again's board chair, but also a health coach that specializes in brain health and dementia prevention. So to kick off, as Joan said, I'm just going to talk a little bit about Sharp Again's programmings and a bunch of the exciting things we have coming up before we talk about assembling your brain health team. So the first piece, and I think you'll see how this really fits into your complete brain health team by the end of the presentation, but we built this support function of the Stay Sharp Foundation coaching programs. And the goal of those is really to give you a community and a coach to help jumpstart your journey towards a healthier brain now, but keeping your brain healthy over the long term. And so the next program begins on October 24th. It's Tuesdays at noon Eastern, and the deadline to register is October 9th. And so what those programs are, it's going to be an 8-week program. You get a one-on-one session with a coach so they really get to know you. You get to create a plan together, and you get 6 health coaching sessions that cover all the different lifestyle factors and habit changes that you can make to make your brain healthier over time. And then we make sure that you can leave that group with a plan, again, having a one-on-one session with your health coach that you've then been working with for 7 weeks. And the good news is we now have a even longer term program that you can pick up after that called Maintain Your Brain. I was just looking at the slides to see if I was about to talk about that. So, and then we have 2 Stay Sharp upcoming webinars. We have Brain Health 101, which is a preventing cognitive decline workshop. So if you come today and you're thinking, okay, I want to assemble my brain health team, but you want to get jump started, that Brain Health 101 is a really good place to just get a few habit changes and ideas to jumpstart your brain health journey. It's going to be myself and Myra on October 3rd at noon Eastern. And then a wonderful webinar on the healing power of music. That's a huge area of research and a really impactful thing that you can do for your brain health on Thursday, November 16th, again at noon Eastern. That's with Tammy Briggs, A Therapeutic Harvest. She's got a really interesting background. I'm really excited for that one. And then we also right now have a series that started yesterday or today. I'm a little confused on my days. I think September 12th through October 4th, 8 to 8:20. So that's a great way to wake up, depending on what time zone you're in, or right before you leave for work, to ground yourself. Vibhu, one of our board members and a really talented coach, is leading that. And finally, you can find all of those sessions recorded and many previous sessions on our YouTube meditation playlist. So with that, let's jump into assembling your brain health team with Lisa Feiner and Nancy Weiser, who are both brain health coaches. And I will let each of them give their own introductions. Nancy?
Oh, okay. Hi, everybody. I am a practicing National Board Certified Health and Wellness Coach in Mamaroneck, New York, in Westchester County, but I work with people on Zoom all over the world. And I've been doing this for 18 years with a specialty in brain health And I've been on the Sharp Again board and working with Sharp Again now since 2016. And this is my passion. I also have a lot of personal experience helping to take care of my two parents, my father who passed away from Alzheimer's and my mother who still is faced with the challenges of it.
Thank you,
Thanks,
Nancy.
Nancy. I'm Lisa Feiner. I'm one of the co-founders of Sharp Again. So I've been doing this work for about 11 years, and I'm a board certified health and wellness coach as well, and a brain longevity specialist. And I've worked with families, like Nancy, individuals and families with a whole range of healthcare issues, but brain health is really my passion. And obviously, we have helped a lot of people maintain and really improve their cognitive health. So it's such a pleasure to be here.
Excellent. All right. Thank you, Nancy and Lisa. All right. Now time to jump in. So in general, what we're going to do today is we're going to introduce the different categories of specialists, doctors, dentists, health coaches, nutritionists. Really, we want to talk about the reality of the team, who you want on your team, how you might assemble that team. And I think a good place to start, Nancy and Lisa, is just, if my family has a history of dementia, what specialist should I work with to prevent this diagnosis for myself? Let's say I'm, 40, 50, 60 plus, and I've seen a family member go through it. I'm worried about it for myself. Who should I be assembling now?
Well, I can start with that, and Nancy, we can kind of
Go back and forth.
Tag team here. So, one of the things that I would mention, if you have a family history of dementia, there are genetic tests that you can do. And I would really start there because you don't have to involve a healthcare professional off the bat. Some people want to know their genetic history and whether they have that ApoE4 gene. You get one from your mother, one from your father. So you could be a 4/4, but you could also be any combination of the 2s, 3s, and 4s from either one of your parents. So, but if you do have an ApoE4 gene, then you are more likely, you have a predisposition, let's say, to getting dementia or Alzheimer's. And if you have that information, there's a lot you can start doing even in your 30s, 40s, and 50s, because your genetics are not your destiny. And we know that the interaction of your genes with the environment, called epigenetics, is really much more powerful. So that's information you don't need to see a professional for. And then, beyond that, if you have a primary care physician, that's someone you could speak to. But it's really a neurologist who would probably do the initial testing to see if there have been changes in the brain. And there are a whole host of other doctors who you could bring into the mix. I mean, at Sharp Again, we typically work with integrative or functional medicine doctors because they look at the body as a series of systems and they see how things interact. And they're much more likely to understand the causes of memory loss that we talk about and, be able to kind of, what I say, triangulate the data, take all of your genetic history and your current blood tests and order maybe other kinds of testing, let's say for heavy metals, if that seems to make sense, and be able to put all that information together. Nancy, what would you add to that? Anything?
That was pretty comprehensive, and just initially you want to be, I think we always want to emphasize that you want to start to get on this as early as possible. So as soon as you notice any kind of anything, we call that the subjective stage, when you sort of know something is not the same as it was before in your cognition, your memory, how you're feeling in that way, to get it checked out sooner rather than later. The old tendency used to be to sweep things under the rug and try to mask and cover up what wasn't the same, what had changed in yourself, rather than getting right on this and perhaps starting with the neurologist and your primary care physician, and then going from there to build your team, which I think we're going to elaborate more on throughout the call. The functional medicine team can be a little bit mysterious in how to put that together. And I just wanted to put out there from the beginning that there are many more services and organizations and practices that are doing this type of work now. You can actually see them if you're on Instagram. They're kind of advertising all over the place now to come and have this kind of comprehensive type of lab testing done, whereas ordinarily your primary care physician will not do all of these tests, like some of the ones that Lisa just mentioned, including heavy metals, including even the ApoE4 gene testing. So if you go to more of a functional medicine practice, and again, it'll take some research to find one, that would be routine testing in those areas. And some of it is not covered by insurance. I want to be upfront about that as well. But that's the best way to start. So I agree with what you're saying. And just so people know up front, this isn't going to be like, here's the name of a doctor. It's not as simple as that.
Mm-hmm. Yeah. So just wanted to put this up on screen as kind of the simple introduction. I want to stress to everyone, your head might be kind of spinning a little bit. This is a complex topic. We're going to be diving deep into each piece that they talked about. And really the thing to take away just right here at the beginning is your primary care doctor, great place to start. And then there's more specialists that can help with more testing, more labs, and we'll determine figuring out which ones might be appropriate for you. Part of what we're going to talk about today, but also part of what some of those specialists do. So with that in mind, I think we already talked about it a little bit, but let's say your mother was just diagnosed with MCI. Which of those specialists that we even just mentioned would you work with, or should you speak to first to best kind of plan out her care?
Nancy, you want to start?
Okay, sure. So I actually would start by talking with a health coach, to be perfectly honest, because they can start to direct you, like we're doing here, to more of these specialists, if you will, in these areas. So I would start with that, because that person can also at the same time address 4 broad categories that will help everybody with their cognition, no matter where they are, if they're kind of advanced in their condition or they're doing this completely preventatively. And those would be with their nutrition, their exercise program, their sleep, and their stress management. So those are kind of the basic pillars that we work with in our foundational program. And then you would want to get more specific with areas that include toxicity for mold and lead and mercury and all other heavy metals, the things that Lisa has mentioned. And then you would go off in different directions from there, finding out if a person has, for example, what are referred to as silver amalgam fillings in their mouth or mercury fillings, and then be able to direct each person in a more specific way toward the specialist that they might need. And that's what we're trying to do here today. So, and we happen to be health coaches, so not a coincidence. That's where I would start.
Right. I just want to make sure everyone knows that MCI is mild cognitive impairment. And so Nancy earlier mentioned subjective cognitive impairment, and that's really that first sign that something may not be right. And then mild cognitive impairment would be the next stage, because not treated, memory loss, Alzheimer's, dementia is a progressive disease typically. So as Nancy said, nipping this in the bud, trying to catch it early really shows the best results. And we've seen that time and again.
Yeah, that's a good point. And I think between these first 2 questions, that really is the theme, or one of the themes, that you can't start early enough. And it's going to be a lot less stressful if a problem does arise, if the team is in place. And you can put this, I'm starting to put a more robust team together, at age 30. And getting those people in place so that I'm monitoring this over the long term. And the nice thing about caring about brain health is basically every single thing we talk about has a crossover to every other chronic disease. So really, when we're talking about preventing issues with our brains, we're really doing a good job of preventing, or at least partially, there's more things you can do if you're specific about heart health or whatever, but really doing a good job of preventing all those other things. So it never hurts to start as early as you can.
I would just want to like take off on that point for just a second, which is that I'm currently working with some clients where there are a couple off of blood pressure medication, off of all the years of antacids that they've been taking, the proton pump inhibitors, losing 18, 30 pounds. Side effects of what we're doing to address the dementia that's running in that family. So yeah, there's sleep, skin, everything gets better quickly.
Yeah, exactly. I'm just going to, let's see. So how do I determine when I may need someone other than my current doctor or healthcare provider? So let's say somebody isn't jumping off and building that team way in advance. What's sort of the decision point where, okay, I like my primary care doctor, I've been working with them, they're doing a good job, or I think they're doing a good job. When do I need to move outside of just that person?
So I'll start on this one, Nancy. I would say that most traditionally trained medical professionals aren't comfortable, going beyond their scope. So they typically will refer you to a specialist. However, when it comes to brain health, even a neurologist may not be aware of a lot of what we're talking about today. For example, they may not be aware that there are actual causes of memory loss. They may know that certain lifestyle issues, such as the ones Nancy mentioned, right? Sleep, stress, nutrition, exercise, will help prevent or perhaps improve your memory, but they're not well versed in the full range of causes, things that might be causing memory loss. And so just knowing that there are other doctors, having that information is very powerful, because then you can either go online. If you think you've been exposed to mold, for example, or you have a mouthful of silver fillings, or traditionally you've eaten a lot of sushi, including tuna, which has a lot of mercury in it, or if you had brain trauma when you were younger. Just the other day, we met a young woman. She was in her late 20s, early 30s, who had been a soccer player and had brain trauma and was now experiencing memory issues in her job. And we started talking to her about some of the things that we know help with that kind of trauma. And she was unaware. So she was glad to have connected with us. So it's those kinds of things, knowledge is power. And with every cause that Sharp again has identified, backed up by research, there is treatment. So there is something that you can do. And so we try to help people kind of narrow down beyond those four main areas that we talked about, where else they might be looking, who else they might be consulting to get help with their particular issue. And, a lot of this will be geographically dependent. There are more, Lyme disease specialists in the Northeast probably than there are in the Midwest or in some other parts of the country. And that's true for these different areas. So, but there are a lot of doctors now who do telehealth, and there's a lot of possibility. And I think it's important for people listening to know that. And we're really here to support you in finding those healthcare professionals.
Anything to add, Nancy?
Yeah, no, that says it. That I would say the same thing.
Yeah, I think there's a lot of different triggers, right? So it might be something as simple as learning all these things that you mentioned. And so you are driven, oh, I have a few of the risk factors. I have a few of these that I want to handle. I'm going to go assemble my team. I'll just add my personal experience, which was I started asking my primary, having the conversation with my primary, hey, I'm concerned about this. I'm worried about these risk factors. And I will say, like, probably the best primary care doctor I've ever had, but wasn't responsive to those longer term, managing those longer term risks. And so I was like, great, I'm going to keep you for, you're going to be my wonderful primary care doctor for the acute things. If I have an issue I need handled today that comes up, that's great. But if I'm worried about my health 20 years from now, I'm going to go start finding some other professionals and finding some specialists to move outside of that. And there, I think another possible trigger would be what Nancy and Lisa both talked about earlier, is that subjective cognitive and climate decline, impairment. Yeah. If you're even feeling anything going on with your brain, even if it's not been detected on a test or something, that's another good time to say, great, I have a little bit of runway here. I'm going to go start assembling my team. So just pulling all those different pieces together. So let's dive into, we've mentioned a bunch of different professionals. We've talked about kind of the team, when you might want to assemble the team. Let's dive directly into, and I'm just going to put all the different potential professionals on the screen as we talk about it. But, let's just jump in and talk about when you might use these different people for a lab work, assessments, why you would even want to work with them. So let's start with, what is even a functional or integrative doctor? We've used that terms a few times. How does that differ from your primary care doctor, and why would you have one? And what do they do for you?
Okay, yeah.
Nancy.
So all of these, I would say, beside, other than the neurologist, but all of these have in common is the thread of using, not just identifying a symptom and assigning a prescription medication as its cure, or alleviating the symptom. This is all root cause medicine. So these people in general will want to be using a combination of identifying potential problems at a micro kind of level, like nutrient deficiencies and toxicities, for example, and then addressing them holistically through a combination of food, supplementation. They will mostly all use supplements, not the dentist necessarily, but the others, and lifestyle changes. So it's functional because they're using functionality, your own functionality, if you will, to work with the system rather than masking a symptom. So that is how I would best describe this. So as opposed to, if you go to most conventional neurologists and say, I'm having memory issues, and you test that you have some kind of dementia, Alzheimer's is one type, they will prescribe a medication that is for memory loss that probably won't work very well. And in fact, some of them can make things worse. So that's what's meant by functional. Integrative is a little bit different, because that will integrate conventional as well as this more complementary type of functional medicine at the same time. They'll do both, is how it kind of evolved. Functional medicine doctors have now kind of taken over what was started by Andrew Weil, 40 or 50 years ago, and has now become the field of functional medicine. So if you're following anyone like Mark Hyman online at all, he is kind of the father of that. So it's evolved. So it's kind of a long-winded answer to say that we work more with the body from a root cause perspective to not just mask a symptom, but use more natural types of remedies to help people get back to where they were. Is that okay? Does that make sense?
Yeah.
Yeah. And I'd also say all these doctors typically, as Nancy said, it's really personalized medicine. They're looking at you as an individual and not just treating the symptoms of the disease, right? So it's personalized medicine as well. The other thing is that this is the first layer. Having somebody who has this very good overview of the body or of your dental issues and is able to address those is great. Beyond this, usually functional integrative doctors, naturopathic doctors, many of these have great networks of people who they can then refer you to if they have identified, like, say, a mold problem. You're suffering from mold toxicity. They themselves might be able to treat it, but then there are other people who perhaps specialize in that, or Lyme's disease, or there are now, integrative cardiologists. There are people who have taken this approach and have their previous specialty and they've combined them. And these are the kinds of doctors like this, like an integrative psychiatrist. Like, that's a great example. The one that works with Sharp again is someone who has been prescribing supplements for his patients for years and has seen tremendous improvement before he would ever, let's say, do a prescription medication, which has, lots of side effects potentially. So
But that said, when necessary, he will also do that.
absolutely. It is neither one, it's not one or the other. It's integrating the two approaches and making sure that the client comes first, the patient comes first, and looking at their history and their experience, whatever their symptoms are.
Yeah, it's a wonderful outline of what a functional or integrative doctor really, root causes, a more complete look at the patient, not just looking at one facet or the other, trying to find and be an investigator on what exactly is going on. And so then how would you work with, let's say you've got a functional medicine doctor in place, and I think we would agree that that's probably a good place to start. Maybe functional medicine doctor or health coach, really, because those two can be the kind of quarterbacks, probably know a number of people that they work with that have expertise in this area. So how would you work with like a naturopathic doctor?
If, as the patient.
As a patient, yeah, as a patient.
So essentially, it's the same for the functional or the naturopathic doctor. The naturopathic doctor has an ND, not an MD. So they practice in certain states. A lot of them will work with you by telemedicine. Once you've seen them in person in whatever state they're working in, they're not working in New York, for example. And so they will do, again, this comprehensive look at all your vitamin and nutrient levels, all the things that Lisa has mentioned and I've touched on as well, the mold toxicity, the Lyme disease, the mercury in your blood, the heavy metals, all of that stuff. And then they will prescribe for you a program of, let's just say, diet, supplementation. It may include things like infrared sauna, which, again, I've never heard of anyone's primary care physician prescribing infrared sauna, whereas I know a naturopathic doctor has done that for people that I know. So in other words, if you show up toxic on top with toxic levels in certain testing realms, that's a very good way to reduce toxicity, is using an infrared sauna. You can use an infrared sauna blanket. That's just one example. If your mercury shows high, the naturopathic doctor or the functional medicine doctor may then refer you to the holistic dentist to get that addressed. So each of these things will kind of sprout legs, if you will, depending upon where you start. But the naturopathic doctor, I think, is terrific because they come at it not out of the conventional medicine training at all. They have a completely different training.
Anything to add, Lisa?
Not really. I mean, we're going to go on and try to help people figure out where they could find these doctors. Right. That's coming up. And I think that's really important.
Yeah, I agree. Well, so let's, I'll just say right here. So we're going to send, as one of the follow-up resources to this, a number of directories where you can start to look up these different professionals, but let's just talk about that as we go with these two sets of doctors and that sort of serve a similar function. How would you even go about finding, let's say this is your first member of the team, how would you go about finding one of these doctors in your area or not in your area, as kind of Nancy mentioned, that you could work with by traveling to once and then doing virtual appointments.
Right. So most of these categories of doctors have national associations that they belong to. One example is the Institute for Functional Medicine, or ifm.org. And on their website, they have, find a doctor. So if you go in and you type in your zip code, it will, spit out the doctors who either are totally certified functional medicine doctors or who have taken some of the courses that are offered. And I would say in that particular category, they do offer the reversal of cognitive decline course within the training. And all the training is listed under every doctor's name. So you would want to look for that particular course that doctor has taken. And, for all of these, I would go, if you think you found someone that you want to go see, or maybe 2 or 3, go onto their websites and read about their philosophies and see if they talk about brain health as one of their primary interests. And you could even go as far as to call the office to get additional information about insurance and other things. You want to have a good feeling about whatever doctor you start to work with. Holistic dentistry, there is an organization called the IAOMT.org. That's an international, dental toxicology organization, and they train dentists to remove mercury fillings, those amalgam fillings, safely. And some dentists know how to do that, but it's very good to make sure that the dentist is using the safety protocols that are in place, because when you remove mercury and you drill it out, it becomes airborne potentially. It can sometimes be like inhaled, or even some of the pieces of mercury could drop into the oral cavity. You want to make sure that every caution is being taken, like an alternative oxygen source, a rubber dam in the mouth. Many dentists will suit up, put on protective clothing when they do this procedure, because they themselves don't want to be exposed to the mercury. So, finding a doctor who's trained in that, or who's done many of those kinds of procedures before is very helpful. And, there are more and more psychiatrists, for example. There are a few in the New York area who have this.
Pause on where to find the lists and talk a little bit about, since we sort of went through integrative and naturopathic doctors, and you mentioned where to get the holistic dentists, where to find. Is it just the mercury amalgam fillings that you would want a holistic dentist for, or is there more to that?
Well, there are dentists trained to do many different things. I mean, some use what am I thinking of? Applied kinesiology to help figure out like where an infection might be in the mouth, if that's an issue. If you've had a lot of dental work in the past, there are sometimes issues with hidden infections that are not symptomatic, or gingivitis, some gum disease that needs to be treated. These dentists are very they know that the bacteria that's found in the mouth can travel to the brain. And so they're very well versed in how to treat that if they're finding that.
And they also can build appliances for sleep apnea.
Right, airway health.
Some people can, some of the dentists can, or you can also go to a sleep specialist for that. But there are dentists who not only treat snoring and sleep apnea, but who also do provide the appliances as well.
Yeah.
And the American Association of Naturopathic Physicians Again, I believe has a search function if you're looking for that. I believe naturopaths can operate in our northeastern area in Connecticut and New Jersey and Vermont and some other states, but it is state dependent, as Nancy said. So that's something that you're going to want to look up. Obviously, California, that's where most of the schools are that train naturopaths.
And just yeah, go ahead, Nancy.
That's the other thing I was going to add is the way that I've become introduced to some of these specialists is by actually joining their online webinar series and conferences. So they're usually free for some period of time, and they try to make you watch it all day long, and then you could buy it for $97 or $67 and something. And then there's one on reversing Alzheimer's, and it's simply called that, reversing Alzheimer's. Preventing Alzheimer's is another one. Lisa and I have both been speakers together on both of those. And then they will run a series of experts you never would have heard of before for like 7 days and 7 nights. You can just watch them all day and all night and say, which one of these people do I want to get in touch with? Because one of the reasons they're doing it is to get business. But I have found some very, very compelling information, as well as access to doctors and naturopathic doctors and other specialists through watching these online programs. So this could be the first of many for you today.
Yeah. Perfect. How would you use an integrative psychiatrist? Where do they fit into the picture?
So a lot of time, well, I was just going to go back to the issues of stress and trauma, which a lot of stress, anxiety, trauma, depression, those are all linked to memory loss. And so you want to get any of those conditions treated. And that's where an integrative psychiatrist can be really helpful. There are a lot of different kinds of practitioners who can help with stress, but long-term, untreated, unmitigated stress really does impact the brain. And you just want to make sure that you're getting the best help. And, as we talked about earlier, that might be a prescription medication, but there are other things that an integrative psychiatrist might also work with you on. For instance, if you've had a head trauma, we know that neurofeedback can be a very good tool to use. So that's just an example, but emotional or physical trauma, an integrative psychiatrist, I think, could be a good person to seek out.
And cognitive issues in general can be helped a lot with supplementation. You have to know which are the appropriate ones to use, and that's mostly what they'll do is come up with a cocktail, if you will, of supplements that are going to be less toxic to the system, less extreme than prescription medications, to help with all of the things that will affect cognition, including depression and anxiety. Which in the same vein will also over time really have an effect on brain health.
Yeah. And one thing to say is all of the holistic dentists, the oral health is very connected to brain health. It's one of the big risk factors. And, all stress, anxiety, depression, those are big risk factors for cognitive decline. So when, all of these fit into, okay, I have a specific issue with those things, I need to add that person to my team. You don't necessarily need an integrative psychiatrist for everyone. That's okay, I have a need outside of my functional or integrative or naturopathic doctor, that they maybe guided me that I need this, or maybe your health coach, you've uncovered that in your health coaching, that you need to fill this kind of role and add a specialist to your team.
For sure, because I just want to say, if we look at the Sharp Again website and see the 10, what we identify as the 10 causes, which are really much more than that, but that's how we have it on our website, and it makes a lot of sense, is that if you discover that you had undiagnosed Lyme or an oral infection, and those things are causing you brain troubles and cognition issues, then of course you might be a person who just never needs an integrative psychiatrist. If you have a large mold issue and you don't have Lyme or depression or anxiety and you get that taken care of, and it's determining that cause or combination of causes. And for most people, there's a tipping point and they have more than one cause. Right. So it may be the mold, the Lyme, and the anxiety. It might be one of those three things. It may be none of those. So uncovering what that is really the most important thing, and then deciding which of these people can help you.
Exactly. That's great.
Yeah, to both of your points, everyone's team is individualized and will be comprised of perhaps different types of practitioners when you get into those specialty areas.
Yeah, exactly. So then how does a health coach fit into this? Why would you have a health coach? What do they do?
So, it's interesting. Many functional medicine practices have health and wellness coaches on their staff because the doctor often will say, you really should be getting more exercise, or we think that you could be eating better for your brain health. You really need to work on your sleep architecture, which means everything that kind of gets you ready for sleep and sets your room up to be effective, your bedroom to be effective as the sleep area. A lot of times people don't know how to go about doing those things. The doctor will prescribe. It's really the health and wellness coach who can sit with a client and learn about their own individual habits and what they've tried before and make suggestions. And together they can set goals and then work toward those goals. The coach is really there to support the client, and if desired, act as a liaison with the functional medicine, naturopathic, or integrative doctor. That's really the role. And, a lot of times people have setbacks or they feel something's particularly challenging, and working with a health coach can help get you through that. It's really much more common than people think to have challenges and setbacks. And that's really what we're trained to do. And we have a number of health and wellness coaches that work with Sharp Again, who have been, they're specifically interested in brain health.
Exactly.
Yeah. So I would, that's great. And I would just add that it's really about the implementation piece, and then the guidance and the support and the accountability. So if I'm writing you an email follow-up after my session with you, and then next time we come back together 2 weeks later, it's like, hey, how did it go with whatever it was, adding leafy greens to your diet, learning what smash fish are, whatever the specifics we're talking about that can help you with your brain health. How is that going? It would be a more frequent kind of conversation, and really where we get to know you on a much deeper level. So it's kind of the information. I like to say it's information, inspiration, and implementation. It's all of those things that the doctor for sure doesn't have the time to spend with you to make it happen in your life. That's what we're here for. That's what health coaches are. So a bit of cheerleader, a bit of maybe a little bit of parenting, and then using the information and working in conjunction with what the doctor ordered. So when I have clients who are working with a functional medicine doctor about their brain health, and they have a list of supplements, we'll go through them together. Why does the doctor want you to take this? Because for a lot of people, particularly older people, they're like, this is all new for me. They think it's weird to be taking any supplements, or to take 6 or 7 or 10. And I'm like, no, this is exactly what you need. This is great. Let's do this. And be diving deeper into why the doctor maybe wants them taking those things, so they feel more comfortable around that.
And I think all of that is you guys hit the nail on the head. The one piece I would double down on is exactly what I think, Nancy, one of the things you were just alluding to, and Lisa, you touched on, is it can be really overwhelming starting this process with a functional medicine doctor, or there can be a lot of changes that you want to make that are going to help your brain, but it can be big change, and having a partner in that process to do all those things to reduce the overwhelm, who's an expert, who's been here before, and who you can kind of trust and make those changes with, can really make all the difference. You need the expertise of all these different specialists, but then the health coach can be your, team member that helps you actually get the job done and makes sure that it's getting done, and supports you along the way.
And I would also add one more thing to that, or more, but primarily this one, which is that most people know what to do. So they know that they should be eating this certain way, or should be exercising more, paying attention to sleep hygiene and stress management. A lot of people know that, but there are obstacles in their way. And it really is helpful to work with a partner, with a coach, on clearing those obstacles, which are, to Lisa's point, that's personalized to each person. What is holding them back? And that is, I don't know, and they don't know. So it's through this kind of discovery, this back and forth, for having people understand, the simplest thing could be, well, yes, I know swimming would be the best exercise for me, but I don't want to mess up my hair. I mean, I'm serious, like stuff like this, and talking through how it is that we go around that type of an obstacle. That's a simple kind of silly one, but it does come up, honestly. What is getting in your way of doing what you should do already, or what the doctor told you in kind of general terms to do? Make it specific to you, and also specifically clearing whatever your personal obstacles are to getting this going.
Absolutely. Yeah. I think that's a good picture of why you might want to use a health coach. Obviously, we're all health coaches. We believe in it enough to be dedicating our careers to it at this point. So it's a strong piece of the brain health team. Finally, we have about 10 minutes left. So let's leave a little bit of time for some questions, but when do you use a neurologist? If it's not a neurologist that's giving you cognitive testing, where might you get cognitive testing? Which of these other professionals would handle that? How do you work with a neurologist and get cognitive testing?
I mean, I can start on that, Nancy. I'm sure you'll have something to add. I mean, typically today, a neurologist is the person who you would go to have that initial testing. What we had found for a long time, and this may still be true, is that some of the testing that's used by some neurologists is not sensitive enough to pick up the subjective cognitive decline, condition. When you think you're having a problem, but they say, "Oh no, you test fine. You're fine." Yeah, I think you really need to rely on your own sense of what's going on, and find another neurologist potentially who can do those tests. There are, for insurance reasons and a lot of other things, you do need a diagnosis typically, whether or not it's an accurate diagnosis, because we know so many things cause memory loss and dementia, and that those things can be treated. The diagnosis is really less important than the treatment you're going to get, but a lot of times that's a starting point for people. They need to have that testing done. And some neurologists will actually do a functional MRI or a PET scan to look at the brain and see if there have been any shrinkage or any changes in the brain. That also can be very helpful to kind of confirm, let's say, a mild cognitive decline diagnosis. So, so that's one thing. What would you add to that, Nancy?
Just when you go to the functional medicine doctor or the naturopathic doctor, they will usually do what's called the MOCA, the Montreal Cognitive Assessment. They'll do sort of simple testing, and you learn a lot from that test. That's a completely fine way to go. If it's very clear what you have, it will come up on that test. If you want the full out, neuropsych exam, that would come through a neurologist, or sometimes you go to a person who's double board certified in both neurology and psychiatry. And that, at any major medical center place that does the full out, exhausting, kind of 2 days of 6 hours each kind of testing. And sometimes you don't need all of that if the case is more clear cut. We hope it's not. We hope it's a very beginning case, and you may or may not want to or need to do that. But yeah, it will be helpful for a diagnosis for sure.
Yeah. And it's worth mentioning that that's often going to be where your primary care doctor, if you bring this up in a primary care appointment, that's probably going to be the first step, is a referral to a neurologist. Oftentimes, that's kind of the tool of the primary care world. Excellent. So just to review before we open up for questions, I think we talked a lot about everything, but let's just walk through sort of the process somebody might have. You're working with your primary care doctor, you realize you need a little more help. Maybe you get some testing with a neurologist, you get a diagnosis, then maybe at the same time you're starting that testing, you would want to find a functional medicine doctor, an integrative doctor, a naturopathic doctor. Really the most important thing in those 3 areas is experience with brain health and in this specific type of work. And then from there, depending on exactly what types of changes you would need, you'd want to add people like a holistic dentist, an integrative psychiatrist. I think we would recommend, if you have to make really any changes, that you would add a health coach to that process to support you. And beyond this, and we will just, for simplicity, haven't covered it, but we've mentioned a lot of other things. And so you maybe have the sense there's other people you might want to add, like a mold specialist or a Lyme specialist, that might become relevant. And I would lean on people like your functional or integrative doctor or your health coach to help find those professionals. And with that, we still have a few minutes for questions. So I'm going to stop. I'm going to put this on the screen briefly. So if anybody wants to write that down right now, all of this contact info will be in the follow-up email that Joan will be sending. So you don't have to write this down to have it. But that's our contact information, and we're always open to be as helpful as we can be. And any questions? Joan, have you seen anything, or do you have any questions?
I don't see any in the chat box, but Lynn, you've unmiked. Did you have a question?
Yeah. Does anybody have a question to shout out? See, John just came on camera. So John, yeah, just ask.
Is there any, to my knowledge, there's no real battery of tests, cognitive testing, that really you can start as a baseline so that a year or 2 later you have the other test and you just lost 10 points. I'm just talking about subjective cognitive impairment that you start, and I'm 80 years old, so I'm old. So my question is there a battery of tests that's universal other than the very basic ones?
Yeah. Nancy, do you want to take that one, or Lisa?
Well, we were talking about causes, kind of exogenous causes to what might be at the root of somebody's cognitive decline, for which you're looking at metrics that are in fact measurable. So if you go to a functional medicine, or specifically a brain health functional medicine practice, you'll be looking at things like thyroid markers, you'll be looking at Lyme markers, you'll be looking at mold, and everything else under the sun that would in some way, shape, or form affect your cognition. So for example, there's a whole battery of tests within the hormone category alone that could be at the root cause of someone's cognitive decline. So there are tests that are done on physiological identifiable causes. Now, in general sense, you could give that same cognitive assessment again a year later. You can do this at home yourself. There's a little test that they recommend, which is draw a clock. So I do it every month. I just did it now because I hadn't done it in a while. So here you go. Well, you can't see it. Where? My clock. Okay, draw a clock and say it's 10 after 11 on the clock. So that's a little test, but I'm just saying, so there are ways to continue to run tests, especially if you identify in the outset, what is this person's to say to Lisa's terminology, what is your personalized cause? And then that can be tested for over and over and over again.
You know, if you're asking for a more general question, like, is my 80-year-old brain like as good as anyone else's 80-year-old brain kind of thing? Like, you want to know for your age group, how am I doing? You know, I do think that the MOCA test is a good test, and you know, some primary care physicians might even be able to administer that. And it's a score, I think, of up to 30. Is that correct? And,
yeah,
you know, if you're in the top like 28 to 30, I think you're okay. And then it scales down from there.
Under 24 is considered dementia, as far as I know.
Right. So there are a few other tests. That's pretty well recognized, that particular one.
You can use, so we use a cognitive test. So there are cognitive tests that test, you know, very specific functions in the brain. They're kind of these mini games that sort of are built to push your brain to the limit, and eventually. So that's one way of longitudinal testing. We use that in our small groups. One of the common recommendations is something like Brain HQ. And if you're doing that over years, and you maybe do that, you know, if you want to train your brain and improve, you can do that 3 times a week. If you want to measure, you might do it once a month. That's an easy and readily available one to do the longitudinal, like, how is my cognition changing over time?
So that is something you subscribe to, Brain HQ. Right. So that's.
And if you start cognitive testing there and you get it with the right professional, they will cognitively test you over time and start the baseline. Even if it's today, that's still a valuable baseline to measure every 6 months going forward. So that's 3 different answers to your question. Any other questions? And
I have a quick question.
yeah.
Oh, and so does Karen. My question real quick is, so tests for mold, are those blood tests?
Yeah. Testing for, as far as I know, some different kinds of antibodies. The thing that's funny with mold is you can have 2 people in the same house. One of them tests for it and one of them doesn't, because it's 25% of the population that has a sensitivity to mold in their environment. So, you know, people sometimes tend not to believe these results, but each thing is very different for each person. But yes, you can have and then there's other tests you can do, like up the nose for different kinds of funguses and bacteria. There's a test called the Marcon test, I think is what it is, for specifically stuff up your nose for chronic sinusitis, which is a risk factor for cognitive impairment as well.
Yeah, it's a lot of the testing that's done on toxins and mycotoxins are urine tests. They're not blood tests. And if they're taken, you know, months apart, you can see if someone is still being exposed by what's coming out in the urine.
Okay. Karen?
Thanks. I'm just curious if you're thinking about this from a fairly preventive perspective, as opposed to having a specific would you still start with a functional integrative doctor, or could you use a health coach at that point?
Yeah, that's a good question. You really could start in both places, and many people do. So I don't know if Nancy or Lisa, you want to elaborate on that, but
yeah, I mean, this is what I do. So I would say, like, I would do an initial consultation and then say, if this is what your concern is, for sure, go see one of these functional brain medicine people. And then let's see what comes back. So then I can work those test results into a program that is in conjunction with what they're showing. And they will often have very high level types of specific supplements to recommend. And then I work that in, and then you want to have the implementation piece work hand in hand with that. So depending on who you know is sort of where you start.
Yeah.
Thank you.
Right. And you can start anywhere.
Yeah.
It's true.
Right, so there's not like it's not like a supplement or health wellness coach perspective that it is, I guess it goes back to not being generic. So you're saying you'd still want a level of tests.
Yeah, you
Go forward.
definitely do want to, yeah, like it really is personalized. There's, you want to get the testing for yourself before investing a lot of time and money in any particular area, just to make sure that that's relevant for you.
And I would just say have an initial a conversation with a health, it's really, or a functional medicine doctor, like that initial consultation and the discussion about your concerns and sort of your lifestyle will tell a lot.
Okay, thank you.
All
John
right.
has another question.
Yeah, last question to John.
Yeah, just one more thing. Might emphasize how difficult these whole things can be. For example, I had a functional medicine doctor. He said, "Well, I think you have Lyme disease or some, tick-borne illness." And testing. Went to my GP. Test me for, you don't have Lyme. Go back to my functional medicine doctor. He says, "Well, I'm not sure whether you have it or not." The results can be very inconclusive on
Yeah.
some of these conditions, especially
Mhm.
tick-borne illnesses that may not be, true Lyme, but it'd be some other thing.
Mhm.
That is getting better and better. They do have
It is.
more specific tests for the Babesio's and the Bartonella and all of it. It is getting better, certainly from where it was even 18 months ago or 5 years ago. That is better. It is still confusing, but it's better.
Good to know.
Yeah.
Thank you.
All right. Well, with that, thank you so much, everyone, for your questions and for your attention. Thank you, Nancy and Lisa, for providing your expertise, and Joan for being kind of the quarterback on this whole thing. If you
Well,
have any
thank-
questions, please feel free to reach out to us and look for Joan's follow-up email.
Yes, I'll get that out probably tomorrow morning. As soon as the recording is up on YouTube, I'll have that link and I'll put together a list of the resources we talked about today, some of those directories, as well as our program update.
Perfect. Excellent.
Thank you all.
Thank you,
Thank you
everyone.
very much.
Everybody for
Enjoyed it.
being here.
Have a great rest of your day,
Thank you.
and hope to see you soon at one of the other webinars or small groups. All right. Bye.